My name is Ed Hellman. I'm scheduling bilateral total knee replacements to be done by Dr. Monesmith. I've been a physician at OrthoIndy for approximately 20 years. My practice is hip and knee reconstruction, so this is a little bit of a change of role for me. I'll be the patient having the surgery that I've been doing for my entire career. One of the interesting questions that I get asked on a daily basis in my own clinic is my arthritis bad enough to have an operation? And I've been helping people answer that for a very long time, and usually I'll ask them a question for follow-up. I'll say to them, well, how much does it interfere with your life? If they say to me, you know, it interferes tremendously, that they're describing a disability, well, then it's very easy, they need surgery. And if on the other hand it's not really interfering with much, then they probably could go with conservative care. What I've found over the last year of my life is that it's probably not that simple. My knees don't really interfere with my ability to live my life. I can do my job, I can go home and take care of my house and do most of the things I want to do, but they hurt. They hurt pretty much all the time. So outside of work, there's a few things I like to do. This may sound unusual, but I'm a really avid snow skier. I skied competitively in college, and this is my 47th ski season. I've had great ski seasons, not so much this year. So it's getting to the point where it's interfering with this recreational activity that I really enjoy doing in the winter. I chose OrthoIndy because I've been a practicing physician here for 20 years. I'm very proud of the programs that we've developed at OrthoIndy Hospital and through OrthoIndy's clinics and everything we've put together on our joint replacement program. Monesmith's a fellowship-trained joint replacement surgeon, as are most of the OrthoIndy joint replacement team. He does an excellent job with his patients. He's been out to my house out west skiing with me, so he knows what's at stake here, and I know he'll do an outstanding job for me.
Hi, I'm Dr. Monesmith, and I specialize in hip and knee replacement. So what we did for Dr. Hellman was bilateral total knee replacement, which means we did both knees the same day. And that's not very commonly done. Probably less than 3 to 4% of the total knees in the United States are done in bilateral fashion. But both of Ed's knees were very bad, and he's young, healthy, in good shape, and so he was a good candidate for doing both. And so we replaced both knees in one sitting. But people often ask me, you know, Doc, when do I know, or how do I know when it's time to have my knee replaced or my hip replaced? Well, in this case, for Dr. Hellman, it was his knees. And that's a great question, and that's a very personal question, because only you know how much you're struggling with your knees or your hips. In Ed's particular case, or Dr. Hellman's particular case, he was still able to work for the most part and get through his routine day, although by the end of a long day in the operating room, he was really sore and painful. But what really tipped it over for him is the things that he really enjoys outside of work: snow skiing, going hiking, just going for a walk with the dog. He couldn't do that anymore. And that's when he knew that it was time. And I think that's kind of how it is for most people. You'll know when you can't do things that you enjoy, or when your quality of life suffers because of your knee arthritis, and you've tried all the other things, medicines and injections and so forth, which he had. That's when you say, okay, enough is enough, and I've got to get this fixed.
So early after surgery, mostly I had discomfort more than severe pain. One of the things that the anesthesiologists here do for our patients is nerve blocks that kind of numb up your leg around the knee, and then we start taking pain medications before the nerve blocks wear off. So I found the pain to be pretty tolerable. So as far as expectations for my knees are concerned, it's a little early to really say whether or not they've been achieved. One thing I can say is that I am definitely walking better than I was before surgery, and I'm only 7 weeks out. This Sunday, we had just beautiful weather here, and I was able to take my dog for a walk of a little over 3 miles. Prior to surgery, if I walked a mile, I was just in pain for hours afterwards. So to go for a 3-mile walk on a nice day was really a big improvement from before surgery. I do have some higher level expectations like snow skiing, and I still have 7 months to get back in shape before I have to worry about that for next year. But I'm confident in how I've progressed in the last 2 months that I'll get there. So I'm very happy that I've gone ahead and done this surgery. One of the difficult things, I think, is deciding when's the right time. And I hear from a lot of people I waited too long. And here I am in front of a camera saying I waited too long.